the Institute, I lead the team of non-communicable diseases, and one of our major concerns and one of the lines of research is rheumatic heart disease. In Mozambique, rheumatic heart disease epidemiology is not completely understood, but we know for sure that it constitutes the first indication for open heart surgery in children and young adults, second only to congenital heart disease. In the area where we are working, Mavalan area in Maputo city, showed that 30 out of 1,000 children in schools had rheumatic heart disease. This is 3%, which is extremely high. Rheumatic heart disease is the best example of a preventable disease which starts as an infection and then progresses to become a severe chronic cardiovascular problem. So we started this project with a small grant from World Heart Federation, and what we did was to initiate or to pilot an experience of using painting of walls and painting of booklets that we designed to educate and start discussing with children, with teachers, and with some parents how they saw what they knew about this condition that, as I told you, is very important. So they use the walls where we have the progression of the disease in 4 stages, from pharyngitis or amygdalitis to rheumatic fever, then rheumatic heart disease, and unfortunately to surgery. The drawing is for younger children who use colors to express themselves in a way, but also to learn. We learned that they were willing to continue, they liked the project, and we had the support of the World Heart Federation. So this is what we call the Colors to Save Hearts. For our institution, it's a landmark project in studying multimorbidity. In our environment in Mozambique, we have infectious agents, and we also have risk factors for chronic diseases. Secondly, we think that from the human point of view, it's very important. We have not been able to spread knowledge in schools after our courses because we did not have data on rheumatic heart disease. With the data that we will be gathering from this project, we want to improve the information that we have and support the ministry in designing its policy for education, for care provision, and also for research priorities in terms of rheumatic heart disease. This is an experience in which we are learning a lot as researchers, as doctors, and as human beings, because we see people in hospitals and we have a perspective from the patient point of view, but seeing them in schools, seeing them in their houses, it's something that is always a learning experience for us.